Sometimes I wonder, is caregiving this hard everywhere or just here in the US? Turns out, it really depends on where you live. I came across this research study comparing caregiving in Spain, England, and the US. The study looked at how aging adults with disabilities get care in these three countries. The differences are wild. First, who actually gets professional help? In Spain, 75% of people with disabilities receive government-funded care. In England, 67%. In the US, only 39%. We have the most people with disabilities, but the fewest getting help from professional caregivers. Then there's how that care is delivered. Spain has way more multi-generational households, lots of adult children living with aging parents. So you'd think they'd rely on family and not use much professional help, right? It's actually the opposite. Spain uses the most formal care, professional nurses, therapists, home health workers. The US uses the least. The reason? Spain and England have policies that make professional care accessible and affordable. We don't. One more thing that stood out. In Spain, being married doesn't change whether you receive professional care. But in England and the US, it does. Married people are less likely to use professional services because the spouse is expected to provide care. The takeaway? In places where professional care is accessible and affordable, families get the help they need. In places where it's not, families are stuck doing complex medical care on their own. The US has the lowest rate of people getting professional help, not because we don't need it, but because accessing it is harder. If your loved one is homebound, they might qualify for Medicare-covered home health care, professional medical care that comes to them. It won't fix the broken system, but it could take some of the medical care tasks off your plate. RubyWell helps you figure out if your loved one is eligible and walks you through what to do next. Check eligibility at the link in our bio.